Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about a relatively simple solution to a very common foot problem. Many people have contractions of their toes, in which instead of the toe remaining straight, the toes will contract upward like this. There are some times in which that toe contraction can become so significant at the tip of the toe that instead of the bottom pad of the toe touching the ground when one walks or stands, it's actually the tip of the toe that touches the ground because the toe is contracted so much at its end. The problem with that is that the skin at the tip of the toe is not capable of being able to receive a significant amount of pressure, unlike the bottom of the toe, which has a nice fat pad to it and is able to distribute that pressure a little bit easier. The result of this is that at the tip of the toe, when it is contracted and there's more pressure to that tip, a corn can form as a result. And that corn can be rather painful, and also the tissue underneath that skin can also become inflamed and irritated. Now there is a bone that's directly at the end of the toe, which also is very prominent at this spot because there's not much that divides the end of the bone and the beginning of the skin, and the bone can also become irritated at the tip as well. In some people, the pressure can become so significant that a wound can actually form at the tip of the toe. Well, the problem with this is that this becomes very chronic, and there's no way of really effectively relieving this pain. There are a couple other simpler solutions that can be tried, including a pad that can be used to push up underneath the tips of the toes in an effort to try to get them out of the way. Now, sometimes that works, but it requires a pad that must be worn for a long period of time. A very simple solution to trying to release the contracture of this toe and bring the tip of the toe back out so that it's the bottom of the toe that touches the ground can actually be done in an office-based setting. What can be done is a very simple incision can be made right at the bottom of the toe, and the small tendon that runs towards the end of the toe can actually be cut. And when this tendon is cut, that allows the end of the toe to be able to come back up again instead of being contracted down and forcing and driving the tip of the toe into the ground. When this tendon is released, that toe comes up, and although it becomes a little bit more flexible at this end, it basically relieves the pressure which is causing the toe to contract downward, and that relieves the pressure at the tip of the toe, making the toes more comfortable to stand and walk on. It heals pretty easily because there's just 1 or 2 stitches that are involved in healing this very small incision, and the end result for most people is reduction in their pain and release of the contracture which is causing the tip of the toe to strike the ground excessively. Well, I hope you enjoyed this video. Please look for more videos on this site as well as others, or you may check out my website at www.inpodiatristgroup.com. Thank you.